They say on social media how they're going on about AOD that it's a fat burner. It is true. What they say on social
I love
media
that.
that AOD is a fat burner, it is absolutely true.
AOD, does it actually burn fat like people claim online?
Yes, it does burn fat for based on the physiological responses that happens with that lipolysis effect, right? It does break down fat, and it's all done in a natural way.
Your health is shaped by more than symptoms. Through real stories and expert insights, we explore how your genetics, environment, and daily choices affect your well-being. We uncover root causes and share practical tools to help you find the healing you need. Welcome to the Forum Health Integrative Medicine Podcast.
Welcome back to the Forum Health Integrative Medicine Podcast. I'm your host, Amanda, and today I am joined by Jocelyn Segal, one of our nurse practitioners based in our Tampa, Florida location. Today we are talking about AOD 9604. Yes, a peptide. What it is, how it works, who it's best for, and what kind of results patients can realistically expect, and what you can do to actually improve those results. There's a lot of misinformation online around peptides, so today we're breaking this one down in a simple, practical, and easily digestible way. Get ready and let's get started. Jocelyn, it is so great to have you on the podcast today. I am so excited to start our peptide series with AOD 9604. Before we get into that, tell our audience a little bit about yourself and how you got on the podcast today with me.
Okay, Amanda, thank you for having me, number one. So I am fairly new to Forum Health. I started in the end of August, and I am directing our Hormones by Design bioidentical hormone monthly program, which has been just one of my wishes along the way of women's health. That how blessed am I to be working here and directing that. But I've also gotten into peptides. So we wanted to really have Tampa stand out as, the leader to get the peptide program rolling. I've become familiarized myself very well with these peptides. I really have a affinity towards AOD for reasons that we'll get into. Just to talk a little bit about myself, I am a family nurse practitioner. I've been for 10 to 12 years, and I was in primary care for a long time. And like most of us, we do get burned out, especially when it became managed care. But when I left, many of my patients were like, they were so happy for me. And when I told them I was going into functional medicine, they're like, well, that's about time because you've been talking it, doing the functional medicine talk for many years. So I've acquired many of the principles of clean health, clean water, clean food. I would, explain how, the things that we're given here on earth, that's what is necessary for our body, for growth, for nutrition. And whatever man created is not meant for sustainment and for health.
Totally, absolutely agree with that. So today we're going to be getting into and starting our mini peptide series. So audience, what you have to look forward to is bursts of peptide education. Today we are starting with AOD 9604. And just for any of our listeners, if this is your first podcast, if you're not familiar with peptides, if you are, fast forward maybe 30 seconds, but peptides are short chains of amino acids. They are the building blocks of proteins, typically containing about 2 to 50 amino acids. And peptides act as messengers, body messengers, directing cells to perform specific tasks like regulating metabolism, repairing tissue, and managing inflammation are just a few examples. Your body naturally produces thousands of peptides to keep our systems working and running efficiently. Because they are small peptides, they act as specialized passwords, I would say, that bind to cells and receptors and tell the body what to do. They are cellular messengers. So that's peptides in a just quick little chunk there. And so getting into 9604, Jocelyn, let's start simple. What exactly is AOD 9604?
Okay. So AOD stands for anti-obesity drug, but I would
Ooh.
like to change that name to achievement over doubt. That's what it should really mean. Okay. Because
Oh.
it is, as an anti-obesity drug, we're using it now to either replace GLP-1s or to add on, because for many patients, they're not able to continue the drug, or they've reached a plateau and they can't move on. But it is a synthetic peptide fragment of growth hormone, of human growth hormone. However, it was developed to act and mimic what growth hormone does in our body, which is fat metabolism. So it was predominantly for that reason that they formed AOD, and with the benefit of it not affecting our human growth hormone levels, nor creating the side effects that human growth hormone can cause, such as fluid retention, muscle or joint pain, or blood sugar escalations.
That's fantastic. That is a great explanation of what AOD is. Why has this peptide become so popular lately?
It's become so popular because we're seeing cases where GLP-1 agonists like semaglutide and tirzepatide, which are very common, these are your brand drugs, Ozempic and Mounjaro, they haven't been successful for patients. And this peptide came along and it's like, wow, we have another alternative treatment plan for patients. And I think that's so important when you're coming in, for weight loss. You want to have a plan set up, and for, in my practice, and it's always part of my mission, is that I will never fail to provide some kind of treatment plan for my patient. I'm very passionate about it. And so when they leave my office, I know that they're satisfied that we have something, a working plan, right, in action. And that's where AOD really comes in. So it's kind of been no more as like a secondary add-on agent for weight loss treatment. And what's really nice is that it spares muscle loss, where in GLP-1 agonists, we have muscle loss, okay, that goes along with the weight loss. And part of this could be because patients aren't following certain criteria about maintaining their protein. But why you see such sudden weight loss in people who take GLP-1, it's because it's not just losing fat, it's losing muscle. And that's where AOD really comes into the picture, is that it spares muscle.
That's fantastic. Yeah, I feel like the muscle loss with GLP-1s that's just one of those big areas that a lot of people are suffering, right? They're losing too much muscle, not the fat, skinny fat, right? So is this the same thing as growth hormone, or is it completely different?
So number one is a synthetic fragment of growth hormone. So it is not truly growth hormone. And that's why when we have patients on AOD, we're not concerned about we still do check their levels, but we don't see an increase in their growth factors. GF1 is the lab test that we check. And so we don't see any increases with the use of AOD. So it's not acting as a human growth factor where you're going to see those changes or those side effects like I just mentioned.
How do you explain AOD to patients in a way that actually makes sense?
So the first thing I do is I want to review their history thoroughly. Like, what has worked well in the past for you? What weight loss medications have you used? What dietary plans have you used? Are you on an exercise program? And then if you were on a GLP-1, why was it stopped? Was it because you reached a plateau in your weight loss and you couldn't go any further? Or is it that you developed really severe side effects? And that's very important to know, because these GLP-1s are known to cause chronic constipation or can cause reflux. I've had some patients where I've had to stop it because, I don't want them to have to rely on taking an omeprazole, an over-the-counter proton pump inhibitor, to decrease the acid in their stomach just for them to stay on GLP-1s, right? So this is where AOD comes into play, where it makes sense for me to go and say, well, we need to kind of put a halt or drop your dose of GLP-1 so we don't have this reflux, and then let's start AOD. I also offer it I explain also that it's an excellent option too for supporting body composition. So there's not much talk about body composition when you're talking about GLP-1s. And when we think about body composition, we want to think about more of inches than pounds. So we want to see how is fat distributed in your body, because it is distributed in different ways. And we know that because some of us have the little muffin tops and some of us have the love handles. And, there's many ways to see how it's distributed. And actually, when I start women on hormones, usually I tell them, let's wait 3 months before we add on a peptide, because you're going to start seeing a little fat redistribution with the hormones. They're very synergistic. And then usually they may not have the exact weight loss, but they'll notice, like, I can fit these pants that I haven't been able to wear in 2 years, right? Because the waist circumference may have been decreased. And we see that in AOD.
That's fantastic. I love that.
At Forum Health, we uncover the why behind your symptoms. With advanced lab testing, hormone optimization, and cutting-edge therapies, we help you heal and perform your best. And now, through shopforumhealth.com, you can access physician-grade supplements trusted by our providers, supporting everything from adrenal health to focus and longevity. Learn more at forumhealth.com and explore supplements at shopforumhealth.com.
Moving on with AOD, how does it work? What's actually happening in the body when someone takes AOD?
Okay. I just went through this explanation with a patient earlier today. So it works by providing two signals. Okay. The first signal is enhancing lipolysis. And lipolysis is the breakdown of fat. And then it inhibits lipogenesis, which is the accumulation of fat. And how it works is in lipolysis, AOD will attach itself to specific beta-3 receptor sites. I know that's kind of big words for some of the people out there that may not know, but just understand that there's many different types of receptor sites in our body in order to cause a reaction, right? We need something to cause a reaction. So this AOD is going to make these receptor sites kind of light up a little bit on fire, and it's going to release an enzyme. And enzymes are what creates chemical reactions, so to speak. So it releases the enzyme lipase, and then lipase actually goes and it converts the stored triglycerides in our body, and it breaks it down into free fatty acids and glycerol. And then these compounds are are sent into the bloodstream where it can be utilized for fuel.
Okay.
And lipogenesis, AOD, prevents the process of converting excess calories into fat.
I love that. And I love that this is like a twofold thing. It's almost like you're stopping it from creating more fat, and then you're also targeting the fat cells themselves and dissolving them essentially.
And when they say on social media how they're going on about AOD that it's a fat burner, it is true. What they say on social media that AOD is a fat burner, it is absolutely true.
Awesome. How is it different from stimulant-based weight loss products?
Well, that's an easy question for me to answer because when I was in primary care, I prescribed phentermine quite often. And of course, I would check on, if they had high blood pressure, we had to have a very clear understanding that their blood pressure had to be within a certain range before I would start them on a stimulant like phentermine. So phentermine is probably the most common weight loss medication out there. It is not meant for long-term use, only for short-term use, usually about 3 months. And what we find is, what we know is that phentermine works directly on the central nervous system. It releases norepinephrine. So norepinephrine is a very potent vasoconstrictor in our brain. It's part of our fight versus flight in our nervous system. But when norepinephrine is released, it actually suppresses our appetite. But it also has some bad side effects too. Like I mentioned about the person who has a history of hypertension, it can raise their blood pressure, can raise their heart rate. They can get a little more nervous. It can cause insomnia. So there's a lot of more neurological effects.
Stimulant, right? Like stimulant. You're going to be stimulated.
Yes. And with that, they're losing weight, not from a metabolic standpoint. They're losing weight because number one, their food noise is gone. Yeah, they're losing calories and they're skipping meals.
And that's not healthy either because now you are losing your ability to put the right fuel in your body. AOD. Does it actually burn fat like people online claim?
Yes, it does burn fat based on the physiological responses that happens with that lipolysis effect, right? So it does break down fat and it's all done in a natural way. This is a reason why peptides are really on the forefront of modern medicine because we've discovered that peptides, right? They're abundant when we're younger and as we grow into adulthood.
And they're natural.
But as we age, like me, the peptides come down. They're low. And so this is why it's considered anti-aging medicine too. And there's nothing wrong about that. These peptides have been proven to be very, very safe. So when we're using AOD, there's also some things that we have to, explain to patients. When you're doing it, you have to have lifestyle modifications and a clean diet and proper sleep. And we'll talk a little bit more about inflammation and, that when we're dealing with fat is inflammation. Inflammation causes resistance in weight loss and resistance in our insulin. And if you want to get more down to the cellular level, but I know we're going to get more into that soon.
Perfect. Awesome. Why do some people feel like their metabolism just isn't responding anymore?
So that leads me to explaining how our body, if we have antagonistic forces inside our body, like inflammation, stress, sleep disturbances, hormone imbalances, it's going to counteract against the effects or negate the effects of AOD. And as we know, like I've mentioned, that fat in itself is inflammatory. So this is why when people start losing weight on AOD and the fat is being burned off, is coming off naturally, all of a sudden, before they'll see even inches disappear or the scale shows a lighter weight, you're going to start feeling the differences. You're going to, because of the inflammation has been reduced. So maybe
Once you,
you'll feel like you can fit the rings on your fingers better. They're not so tight. Or maybe I'm
mm,
not so puffy in the morning, or even my eyes, I don't have as many bags.
mhm.
Overall, they're going to start feeling the difference before you actually see the results.
If you reduce inflammation, which fat loss, lipolysis, dissolving that fat in the body is reducing inflammation because fat is inflammatory to the body.
Yep, correct.
Looking at who is a good candidate, who tends to do really well with AOD.
I think that anyone anyone can be a good candidate. I think that if you have the motivation and the desire to achieve your weight loss goals or improve your healthy lifestyle, anyone is eligible for it. But especially, typically who we see again are those who, are just suffering. Like they'll come in and they're like, I don't understand. I'm doing all the right things, right? I'm eating a clean diet. I'm exercising. I'm doing my muscle strengthening. I'm sleeping well. I just started bioidentical hormones with Jocelyn. I'm doing all these things, but something's not, I'm doing the right things, but I'm getting the wrong results. And so it's
Mhm.
very, very frustrating for patients. And so I want everyone to know everyone will be given the opportunity to have their treatment plan reviewed. And really, AOD is a great second option or even a first option. Like I discussed with one of my patients who's in perimenopause. A lot of perimenopausal women, they just want to get rid of that 10-pound belly fat. They're not
Mhm.
really concerned too about like reducing maybe their A1C, or maybe they have insulin insensitivity. They want to lower their fasting insulin levels. No, they just want to lose that belly fat. So it's actually it comes in to be very handy for my ladies in our program. Another good factor I want to mention too is having a health coach available too. I think in order for your plan to be successful, we here at Forum Health, we have health coaches, and our specific health coach for Tampa is Amber Shuey, and she is amazing. She just has a great rapport with patients, and she's like really like their top cheerleader.
Yeah.
I've been in on her visits before just for shadowing in the beginning when I first started working here, and she has an amazing impact on patients.
And this is almost like a reverse question. So we know that AOD is a good fit, especially for patients who are following those lifestyle factors. So, who is not a good candidate for AOD and why?
I would love to say that everyone is a good candidate, but we have to be careful. So,
Mhm.
patients who may have uncontrolled diabetes and they may be on multiple medications, although AOD won't interact with those medications, we are concerned that there could be some metabolic disturbances along with that. The
Mhm.
same with severe cardiovascular disease. Okay, we have to be careful. Remember, we're pulling fat out of your body. Your bloodstream is going to be the tank is going to be full with a lot of fatty acids rolling in. And that in itself could be a pro-inflammatory factor for some people.
Yeah.
During our plan, we usually explain too how important, the hydration, that's going to be very
Yeah.
important too, that if you're on it, you need to flush out the tank to make sure that you
Yeah.
don't have any residual buildup.
Why is it so important that when you are starting a protocol that involves AOD, why are following like certain lifestyle principles and lifestyle changes so important? Like, why can't if I'm on AOD, why can't I go to McDonald's?
I think that's a very natural reaction that people have, right? They want an easy fix or a quick fix. And
Hmm.
I did that in my practice with phentermine where I would use it because, they had a wedding to go to and they just needed to
Hmm.
lose the weight quickly, or they knew they were going on vacation, and they knew that they would be overeating and maybe not
Hmm.
exercising as much. And so they would use as quick fixes. But it's not to say that you're not going to lose weight if you are sedentary, if you aren't eating a clean diet, but it's not going to be optimal and it's not a healthy way of losing weight. we need to have things on hand, the important things on hand, like having clean food, fresh food. Every time we
Movement.
put something in that may be processed, we're now going the opposite direction. You're now creating inflammation. And now the AOD, it's got more work again to do. You're putting more stress on
Mhm.
that peptide to do the work, and you're not going to achieve the results that you would expect.
A lot of times when I used to talk to patients about this also, when you're looking for at AOD, I want to keep doing what I'm doing. I like sitting on the couch or I'm sedentary. I'm looking for something to give me quick results. Peptides, like we said in the beginning, are cellular messengers and they're going to signal to the cells to do work. And if you're not providing the environment for your body to accomplish that work, these are cellular messengers. Like you said, they're going to attach to receptor sites and they are going to tell your body to do all the things. But if your body doesn't have the ingredients or the environment to do all the things that you're signaling it to do, you're not going to get the results you expect. You'll get some results because you got some of the environment in place. But if you're not putting all of your pieces of the puzzle together, you have an incomplete picture.
That is so true. It's not meant as a replacement for lifestyle. In AOD, in the protocol, it strictly says this is for body composition as adjunctive with lifestyle modifications like diet and exercise.
So, talking about like results and expectations, what kind of expectations should people expect? How long or how quickly do patients think this works versus the reality of the situation?
I think that's an important concern to address because, like I mentioned before about that quick fix, people just they may not be patient to give it some time. The speed of weight loss is going to vary per person. And, in AOD, you will see, you may be disappointed in AOD because you may not see the results. Like I said, you will feel the results before you see it. We use more of waist circumference measurements versus looking at the scale. These are the things that are going to show us how well the peptide's working for you. I think overall, setting yourself up for realistic expectations will help avoid feeling like a failure. So I think that everyone needs to be patient with themselves and say, okay, I'm going to allow this amount of time. And typically we are prescribing this medication for 12 to 14 weeks or 12 to 16 weeks. You could start seeing some results as early as 4 weeks. Again, results does not equate the same as results to a GLP-1. So the results may be, I have less inflammation in 4 weeks. I feel great. I can fit into those pair of pants or I looked on the scale and I did lose a couple of pounds. It's not going to be as evident in the mirror that a GLP-1 will be.
I have a love-hate relationship, probably like most women out there, with the scale. This is also about body recomposition. And like you said, you could be feeling the results before you see the results, especially on the scale. Body recomposition. Muscle weighs more than fat. Okay. So if you lose a pound of fat, but you gain 2 pounds of muscle, like if you've ever seen out there, maybe we can have somebody clip this in for us, but like 5 pounds of fat is like big. It's big. It's a lot, right? And 2 pounds of muscle, 5 pounds of muscle is a lot leaner. So the scale might not be, it's a way to track progress for weight loss, yes. But I really love our in-body scales that actually shows you your body recomposition. It shows you where your muscle and your fat lie. It gives you how much muscle versus how much fat you have in the body. That feels like a more realistic way to measure success with peptides like AOD that, yes, they help you lose weight with several different mechanisms of action, but they're also doing body recomposition. We want you to build muscle and lose fat. And if you're building muscle and losing fat, that's not always going to translate on the scale.
Place the scale in the garage while you're on AOD.
Stop into the office and get your in-body done, right? Get your body composition read, right? Love that. And like you said too, you guys are using other, like, do your waist circumference. And I love too I used to do this with coaches too, is doing biweekly or monthly check-ins and doing progress check-ins where what was your energy like this past month? And like things that you're not going to necessarily notice on the scale, but is your face less puffy? Do you have more energy? Do your joints hurt less? Like there's a lot of non-scale wins. And I think that's I think that one of the big values of a coach is they're going to help you see those results and keep you going and on the right track as well. So with AOD, what can patients do to actually improve their results while using AOD?
So there's a few things that need to be done. First, that protein intake is going to be very important. The RDA was just recently changed. Now the
Mhm.
recommended daily allowance is zero point 0.5 to zero point 0.7 grams per pound of body weight. So for most people, that's going to equate to maybe 90 to 120 grams of protein a day. Obviously, if you're heavier and you're over 200 pounds, you're looking at 200 grams of protein. I think the greatest challenge really is how can I get that much protein in 24 hours, right? Not even 12, 24 hours, in 12, 18
Mhm.
hours before I go to bed. That's where I love our health coaches because Amber does a great job and really, she comes up with these recipes too that's high in protein. And then of course, many of our products from Inwell, our complete cleanse, our total reset, they already come with 20 grams of protein. That's awesome. You already started, Amber's already given me some ideas of, where to go for like, healthier protein bars to choose from. Been great. And so I just, forward that information over to my patients and family too as well.
Yeah.
The fiber is very important too, right? Because that will also help with transportation of fat out of the body and muscle training. So even though AOD is muscle sparing, just the combination of increasing muscle mass and flexibility also will help our joint. It increases
Mhm.
your energy. It's going to help you sleep better at night. So they're all a win-win.
So protein, fiber, strength training. I would say hydration too, because
Yeah.
you're one of the big things with this is breaking down fat cells. Toxins are stored in your fat. AOD is going to help dissolve, reduce, get rid of fat cells, right? So we're going to be dispersing more toxins into the body. The liver has to be prepared for that. I love your suggestion for the complete cleanse because not only does it give that 20 grams of protein, but it also supplies all of these nutrients to support phase 1 and phase 2 of liver detoxification. Brilliant, brilliant, brilliant. So supporting the liver, supporting detox, you want to flush the toxins out of the system, right? You want to get them out. You don't want to feel them anymore. Fantastic. Does sleep and stress really impact results that much? AOD and the daily 5 days on, 2 days off. Are they doing this at a certain time in the day? Do they have to do it on an empty stomach? Are there any other considerations when they're giving themselves this injection?
Yes, we do prefer that it's given in the morning on an empty stomach. If they do have some GI upset, they would contact us. We can always give them a little Zofran in case they're a little nauseated with it. But typically,
Mhm.
a lot of times it's like we, increase your fluid intake because again, maybe that's just you have the lipids flushing that need to be flushed out.
Right.
Try to look at other things. What other modalities can we use to help improve your symptoms? But for the most part, if they stay well hydrated, they're eating clean. Usually, if there's any side effects, I've had the few people that I've already had them on, they've been tolerating it very well.
It could be an alternative to GLP-1s if you're not finding success or if you're stalled, those kind of things. So alternative or an add-on to GLP-1s is
Mhm.
one way to look at it. Going back to the injection, empty stomach in the morning, how long should somebody wait to have food then after they give themselves an injection?
They can eat within about 60 minutes.
Okay.
It's fine. It's just it works better in a fasting state, not
Yeah.
that yeah, not that food is going to really cause any side effects for them. It's just really by being in a fasting
The
state, it's going to
effectiveness.
work
Yeah.
better.
Why is it important to work with a practitioner instead of just ordering this online?
Well, let's first talk about the online ordering because it can be done. I had a patient that told me that her husband ordered a peptide online from China.
Mhm.
We have to be careful. Any product that comes outside the U.S. and that's called offshoring. We don't know. There could be harmful ingredients that could be added in there. Other countries may not be following the same rigorous standards that we do. As far as what we're putting into our products, and then the compound pharmacies that we use, we want to make sure that they're top rated. That they, what's interesting is compound pharmacies go through more rigorous testing and observation, than any local Walgreens or CVS. And many
Yeah.
people don't realize that, but they do. They have to meet state standards. So a practitioner, why is it important for us to have a practitioner? Because you need an expert. Okay. Again, if you may go down the street to a med spa and they may have it there. Okay. But how experienced are they? And they may be a nurse practitioner or PA, because you have to be licensed in order to prescribe these peptides. But, what's their years of experience? Who do they have on board? What allied healthcare professionals do they have on board to assist you on your journey? So you definitely want to make sure that you're with a provider who not only
Are they
has,
following up with you? Are they giving you a personalized dose? Are they in tune with what your side effects are? Do they understand your goals? Are they giving you lifestyle recommendations? Is it just a prescription and then I'll see you tomorrow?
yeah.
Or is it, let's talk about if this prescription is right for you, and let's talk about what else you need to make sure that you're doing in order to achieve the results that you're getting. And by the way, if you have this side effect, and this side effect, these are the tools that we have in our toolbox to help you with those. So if you are using a practitioner, yay, you should. But two, are they engaged with you as a patient? Do they understand your final results? Are they asking you for a follow-up? Are you kind of just set off and saying, here's the dosing protocol, have fun, I'll see you in a few months? Are they following up with you? Are they making sure that this is working for you and with your body? Are you getting the right lifestyle and complementary protocols? This isn't just a pill for an ill. There are things that you're going to need to implement in life. Make sure you have on your side in order to achieve the results that you're really, really looking for.
Yeah,
Awesome.
that is so true.
What is the biggest misconception you wish patients understood about peptides like AOD?
Oh, that peptides are so dangerous, I mean, I'm gonna be honest, when I was in conventional medicine, I'm like, what is all this hoopla about peptides and anti-aging and all that? But, this is what happens when we're not involved or taking the time to really do the research to find out more about it, because there's a lot of misleading information out there.
Yeah.
And what's interesting is that, insulin is one of the very first peptides that was made, and the FDA, that took a while even for the FDA to even approve that. So, things are slow when it comes for the FDA to approve things. And so something could be sitting on the table for years before it's actually looked at. And, we're not going to prescribe any peptide unless it's safe. Okay, that's
Right.
number one. And we have enough research and data to support the safety of using peptides.
I think one of the big misconceptions about peptides like AOD and like weight loss peptides for me is also it's kind of like the pill for an ill. Like if you take this, here's the results that you're going to get. And I think one of the big misconceptions is like these peptides are here's your solution. And it is a tool that you have to, again, they're cellular messengers. You have to have other things in place. And I think also timeline. I think expectations for patients is also kind of a misconception. Like, I'm going to start taking this, I'm going to start seeing results in like a week or two. And to your point, setting up the right expectations, setting up the right lifestyle, making sure that your body's prepared for these things work and they work well, but it's not going to work well in an environment that is not conducive for the cellular messenger to get the worker bees in the body to go and get the results that we're looking for. So I loved this podcast. This is going to be so helpful for so many people. Stay tuned for more, everybody. We've got more peptides to discuss. Jocelyn, thank you so much for joining us
Thanks for
today.
having me, Amanda.
And there you have it, folks. Hopefully this helped simplify some of the confusion around AOD 9604, what it is, how it works, and who it may be helpful for, and what realistic expectations actually look like. Peptides can be an incredible tool in the right patient, but they work best when combined with the foundations: nutrition, movement, sleep, stress management, and overall metabolic health. If you're curious about learning more, don't forget to visit forumhealth.com to find a practitioner near you. And don't forget, we have just launched our new peptide consultations. Get in today.
Thank you for joining us on the Forum Health Integrative Medicine podcast. Each episode, we help you understand your health from every angle and inspire your lifelong wellness journey. Follow the show, share it with someone who needs hope, leave a review, and take the next step toward feeling your best at forumhealth.com.